Important.
Because no one is...
I think it's important, period, right?
Yeah.
And I think it's also important for you to do it, so for two reasons.
I just feel like there wasn't really enough people.
There isn't. I don't know if I ever told you, but if I did, tell me, I won't repeat myself, but I started writing a book many years ago on my...
Welcome to episode 7 of Occult Awareness, the podcast dedicated to uncover the hidden truths of rare and misunderstood medical conditions. I'm your host, Amy, and today we are joined by Mark Michalica, a licensed professional counselor and a remarkable therapist who has a deep understanding of the psychological challenges faced by those with occult conditions. In this episode, Mark shares his unique journey from battling chronic health issues himself to becoming a therapist who approaches mental health with a holistic perspective. We explored the intersections of mental and physical health, the pitfalls of traditional medical diagnosis, and the importance of looking at patients as whole beings. So let's dive into the enlightening conversation today. Today we have Mark here, and he is a licensed professional counselor. And he's actually my therapist, but today we got a different view. And also I know that he had a lot of chronic issue in the past and really can tell you a little bit more about him from the patient side of perspective. And so welcome, Mark.
Thank you. Hello.
So I want to start with just talk about a little bit your professional career. And
I got into counseling because of my background in history. I probably never would have gotten into counseling, but my undergrad was in health sciences, and at that time, while I was still doing my undergrad in '89, I started having health issues. And that went on for 8 years, so I won't get into that right now. And as I was coming out of that, recovering from that, I had been already at that point my own health advocate. I had been researching in-depth health issues as you have as well, trying to get answers to help myself. And so from there, I wanted to continue in the health field and became a massage therapist. Was involved in other things at one point, and somehow eventually ended up in counseling. It was a progression. It just it wasn't something I planned. I had a point where I was like, I know that my undergrad isn't enough. I need to go back to school. I don't know what to do, and I had thought about going into chiropractic or acupuncture or counseling, and I decided into counseling because I thought at the time I could use some of my other skills and experience from my own personal life and in other ways to kind of look and help people in a more holistic fashion. So
nice. So more like towards a holistic medicine.
I mean that's always kind of my focus, because that's just my background. So when I talk to people and meet people, I'm not just listening to their few complaints that they might have in that moment. I'm also looking at their background, which sometimes they don't want to go there or they don't want to talk about, or also physical health issues. I try to look at the whole picture just because it gives me a different and I think a better perspective. But
yeah, I think that's really awesome, because I think that is what right now medical system kind of lack, is to see a person as a whole. right? So can you now
you said that it lacks, right?
Yes.
Yeah, it lacks. Yeah, it does, unfortunately. I mean, like I said, when I started developing health issues, it was 89. So how many years is that? Now it's 2024. So that's 24, 34.
like 32 decades more.
That's a few years, and we've made some changes, and at the same time we almost haven't. So there's a lot more work that needs to be done.
Yeah. So can you go into a little bit more about you as a patient at that time?
So I mean, when you're looking at anyone, I'll just be general, and then I'll go back. I'll go to myself. When you're looking at anyone dealing with chronic health issues, the way I look at it is there's sometimes many factors that lead up to it. I sometimes look at a simple metaphor like the barrel effect, where many factors lead to someone eventually developing chronic health issues, and then the treatment oftentimes. Well, not to jump ahead, but the treatment oftentimes, the way the medical community looks at it, is treating symptoms. But even if you're trying to treat the problem, you can't just treat the final thing that caused the person to develop the chronic health issues. Let's say someone was exposed to mold and then they started developing chronic health issues after that. Mold is just one factor that may be among many that cause that. So in my case, the final factor or the final straw that caused me to have health issues was I had a virus in my undergrad, which you don't hear much about these days, but it's in the herpes family, Epstein-Barr, cytomegalovirus, all of those viruses. So it was kind of similar to what people talk about these days with the word long haulers. And so I had CMV, cytomegalovirus. I didn't know it at the time. I don't even know if the blood work existed for that back then. And typically one would, even with something like that, which was pretty typical, Epstein-Barr back in the 80s, 90s, people would get sick for a couple of weeks and then they would get better. I didn't, and after I got over the virus, so to speak, I started developing severe food allergies and systemic muscle, tendon, ligament issues, and that just progressed to the point that I could barely dress myself and barely function, and I lost a lot of weight over the years and saw probably over 50 doctors and other health professionals as I was again researching different treatments and modalities and all of that, and that's how I ended up in Texas.
So from what you said before, as there are pretty much not many changes in the health field for almost like 3 decades now. So can you elaborate?
It seems to be quick, but 89, that's 90 plus 10 is,
Can you elaborate?
35, 36, I can't count right now.
It's okay. Yeah, it is a long time. I wasn't even born yet. Like, I'm a 1990 baby. And so, I mean, I'm already 33, almost 34. So I think I can count a little bit better because of that. But going into a little bit more, since you said hasn't really changed much, and so what do you mean by that, and what do you feel that it hasn't really changed?
Well, I think there's more awareness than there was back then to what I would now call complementary health approaches. More people are aware of meditation, yoga, herbs, and other approaches like that. And at the same time, many approaches have not really gained any kind of recognition. Different types of bodywork therapy, like something I mentioned to you, craniosacral therapy, myofascial release, Rolfing, energy work, Reiki. A lot of people are familiar with Reiki now, even though there's a lot of controversy around that type of treatment among many people. Homeopathy, not much has changed in that regard. So you have all these modalities that have been around for a long time, even acupuncture, right, from your home country, so to speak. It's a much more of a subtle way of diagnosing and treating people, because you're not using blood work. You're basically looking at energy and energy systems and how organs work together. So so there's been obviously knowledge about these systems for many years. There seems to be more of at least somewhat of awareness in the general public, but I wouldn't say it's really helped. And in the medical field, I think I am aware that some cancer treatment facilities like MD Anderson and others are starting to incorporate nutrition, which they never did, which is surprising in itself, but they never thought nutrition played any factor in your health years ago. And so now they're starting to understand that, yes, what you put in your body actually does make a difference. Yes, meditation is something that can help with stress and other issues. I mean, there's plenty of studies to show that it can be helpful for many things. And so they're starting to incorporate some of this, but it's still considered, I think, kind of as an adjunct, or as a kind of on the fringe in some way. It's really still not incorporated into the diagnosis, into the kind of view that they have when working with patients. And the words I use are the medical model, right? Their medical model.
So if it's not in their medical model, if it's alternative medicine, do you see how much the medical field that is acknowledging that diagnosis, or are they just feel like it's still kind of on the side of like, oh, that's not our MD who diagnosed you? Does that make sense? If you take whatever acupuncture and the other doctors who did a little bit of myofascial or and then going back to the medical doctor, say, hey, they said I have, for example, craniocervical instability, that's what I have, and then the actual neurologist or neurosurgeon would acknowledge it, or still like kept brushing on the side as that's not what we look for. Does that make sense?
So I think, first of all, the medical model, the way I see it, I mean, where we have all these specialists that divide the body up into pieces is a problem in and of itself, because the body works as a whole. The body also works on an energetic or spiritual level, a mental level, in an emotional level, and it all works together. But when a doctor looks at someone, they are also limited by their knowledge and by their training, and so if it doesn't fit into, I keep saying this, and I don't want to put them in a box, but kind of like if it doesn't fit what I know, or I don't have a medical instrument to test you to see, oh yeah, there's a problem or there isn't a problem, well then
it's not there.
It's not there, I guess, in some cases, or at least that's the way some people have viewed it, and that's the way people looked at me when I was going through health issues. I didn't fall into a category or into a box, and so obviously there's either no problem or maybe something in the future can help you, or maybe there's some snake oil out there that will help you, because that was the view that some doctors have, and still unfortunately some have, when it comes to some of these other modalities.
Yeah. So I know I was really frustrated about the whole entire journey through getting even diagnosed, and then often telling you that how it is not really possible for them to really acknowledging there is something wrong.
Yeah.
How do you feel about often getting those tests back as a patient and then telling you that it's just all normal, but then you feel not right?
Well, it's been so long since I've been a patient that it's hard for me to share my experience. I know when I was ill, I was so focused on getting well and getting answers that I didn't let what doctors said. And I was once told by a group of doctors that maybe there's some snake oil out there that will help me. Those were actual words that were used, but I didn't let it. Somehow it didn't linger in my head, and it didn't keep me down. And I can't tell you why it didn't. Probably because I was so stubborn that I didn't know anything better but just to keep moving forward. And so I continued. I continued to do my research. I continued to seek answers, and I can't tell you what made me do that. And some people would use words like synchronicity or it was divine intervention or God or all kinds of different words. But somehow I ended up in Texas, where I worked with a medical doctor, which is also an interesting story. I'll just say a word about that. He's passed away now. Dr. William Ray, who started and used to run the Environmental Health Center of Dallas, which is still in operation, but a different doctor is now running it, Dr. Elizabeth Seymour, and the center still exists in Plano, Texas. But at the time, Dr. Ray was the foremost expert, not just in environmental medicine, but other chronic health issues. And he worked with people all over the world, because he worked with patients that doctors literally gave up on. And you've met doctors like that, I think.
Yeah.
And when he first met me, he didn't seem fazed. He just brought me in and was like, well, you're going to go to the hospital. We're going to put you on TPN, which no doctor up until that point had ever suggested, which is an abbreviation for total parental nutrition, where they basically mainline you through the chest and feed you with an IV. All of that was in glass, because he was a firm believer that plastics and all of these chemicals have an effect on our health. So I went from almost 110 pounds to gaining up to 140 pounds again during my 1.5 month stay, which basically changed my life. My allergies went from, I look at a lot of things on a spectrum. They went from, up here would be 90% to down to 20%. Literally overnight. Of course, he was a part of other things that I was doing and other people I was working with, but if it wasn't for him, I would have been long gone. And I guess that's what I wanted to say. I'm sorry for jumping in. Okay. He was a medical doctor. He was a thoracic surgeon. So as a thoracic surgeon, he performed colon surgery on me. And the type of work that he did in helping people was way outside the box. Even the type of allergy testing that the clinic that he started did. And during his career, he was sued multiple times by insurance companies, I believe by the Texas Medical Board, for practicing and doing things that they believed he shouldn't be doing. So,
did he ever get suspended with his license?
I don't know if it came to that. I believe he was able to avoid that and fight through that every time. But it was not easy. I know that because I know it happened many times.
I think this is really important for patients even to know, because they often, even though I've talked with other experts in the field of like public health, and I often think that it's normal for a doctor to be in the box because they don't want to be sued. And then often we also hear, don't go to that doctor because he has a lot of lawsuit on himself. But the funny thing enough, like when I hear the lawsuit is all coming from the medicine board, not from the patient themselves.
In this case, I would say yes. I think sometimes it can come from patients, if there's, of course that happens. We all know that. I don't know if he ever faced any lawsuits from patients, but there was many from the medical professionals, unfortunately. And even his diagnosis and his treatment of me was way outside of the box. I had seen many gastroenterologists by then who were specialists in the GI system. Nobody ever suggested TPN. Nobody ever suggested colon surgery. So unfortunately, so even within our medical system, and with the knowledge that is known, again, a lot depends on seeing things. I don't know what words to use in a different way, in a more holistic way, being more open to using that information to piece things together in a way that may not fit what we think is the standard narrative, and being open to accepting that we don't know everything, and that there may be things that we still don't know. So there's a couple things going on, right, with the way doctors sometimes view patients. This has been common. I've had a number of patients who come in to see me who, and obviously I'm not a medical doctor, but are exhibiting common signs of hypothyroidism, and they've been told many times that, well, your blood tests are normal, you're fine, and so you should go see a counselor or a psychiatrist. And the crazy thing is that even within the medical field, there's a term for that, and they know this. It's called subclinical hypothyroidism, which means that you have symptoms, but they don't show up on the blood work.
Because as a medical field, they said, well, everything seems normal, right? Tests supposed to be within normal limits, and so you should be fine, and then send you to the counselor. And you're as the counselor, and now like you see these patients, and you're like, oh, I mean, I hear those stories, but I do really want to hear this part, because I think it really reflects the fact that the within normal limits just doesn't really seem to be.
Normal is a setting on your dryer, right? So that's, that saying, have you ever? So anyway, normal is a setting on your dryer. Yeah, there is no normal. So these normal limits, these things, whether it's MRIs or CAT scans or ultrasounds, or then we go to blood work. If something shows up on your blood work, you've got some serious problems by that point. It isn't like, oh, like blood work is so sensitive. Look, we're seeing something on your blood work. This could be a problem. You better get some testing on this. No, if it's showing up on your blood work, you've got serious problems by that point. So these kinds of tests oftentimes are very, I'm going to use the word, I don't know if I'm saying it right, gross, or is that the way you even say it? Gross? I think it's gross. They aren't as sensitive as we believe them to be. They just aren't. Honestly, you were the first person that brought the term FND to me. I don't know if it was around when I was sick, because I'm sure they would have used it for me. And yeah, I can speak more about that as well.
Yeah, definitely. I mean, FND as a diagnosis of functional neurologic disorder, basically, I present so much of neurological issues, but because it doesn't really show on MRI, it doesn't really show on tests or lumbar puncture or the CSF, and so I'm considered as just like functional, as a nicer term in a way, as I saw that it's still in the Mayo Clinic of / conversion disorder. It didn't really change it. Yeah. And so it's basically the brain has something to do with software to really connect with the body, which we already know, like in my case, that was not true. Do you feel, as we talk about conversion disorder, do you feel like over the years you see patients with more of an overdiagnosis or underdiagnosis?
Of mental health issues or
diagnosis in general?
That's a broad question.
That would be a little bit broad.
But, okay. Yeah, I mean, well, definitely in terms of mental health diagnoses, there's a lot of general diagnoses that I've seen that are thrown around left, right, willy-nilly. Bipolar is one of them, way overdiagnosed. And even though I don't know if I have to say this or not, sometimes even if someone isn't bipolar, sometimes bipolar meds can help balance things out in certain cases. But a lot of diagnoses that are thrown around, and sometimes, yes, too many diagnoses. I mean, that's kind of their thing, is to diagnose and treat with medication. So sometimes I think they feel like their hands are tied and they don't know what else to do. That's my perspective. But honestly, I think one of the biggest things that we're oftentimes missing is this, and I've seen it, and I continue to see it again and again and again, and that is PTSD. I think we're starting to recognize it more, but I think a lot of people still don't. And again, I think there's different degrees to PTSD, but nobody that is alive today hasn't experienced some level of trauma. It's just to what degree, and I think PTSD then can lead to different mental health issues, from depression to anxiety to mood swings to this to that to everything else. Again, we don't recognize it.
So I know that you probably had a lot of cases of people who have depression or anxiety, and can you speak a little bit more about often people experiencing anxiety or depression versus actually call it as a disorder?
I'm not sure if I understand.
Because I want to see what your perspective is as a professional counselor, that often a lot of patients might come in saying that, that's the disorder they have, like anxiety, general anxiety disorder. But, we all have life events and stuff.
Yeah.
So they might not really have disorder in a sense, but then was just having depression or anxiety symptoms. And do you feel like with talk therapy that helps most of these cases, and not medication? I know that
Let me say this first of all. Sometimes we use terms like my anxiety, right, or my depression, or we identify with with anxiety or depression or bipolar or this or that or whatever it might be, and I don't see it that way, and I don't encourage the clients that see me to see it that way. But so I will make gentle suggestions, to see it as again, as more of symptoms, oftentimes of again, like I said and you said, of issues that may have happened, things that may have happened to them in the past, and some of that may be genetic as well. And so when working with clients, I try to look at it from a kind of a holistic perspective, even in terms of the treatment, rather than just, you have depression or anxiety, so therefore you must need medication or CBT counseling. Excuse me. Everybody's different, and so I do my best to meet people where they're at. And kind of try to work from that perspective.
So when a person from a medical world to getting the diagnosis of certain anxiety, depression, like illnesses, and it come to you, do you feel like, so I don't know if you are familiar with going to doctor's office and often getting screening for depression or anxiety?
Oh yeah, it's a short little, simple little.
Do you feel like those are helpful?
Not really. In some cases it might be. I know what they're trying to do, but whether they're helpful or not is questionable.
So what do you mean they're trying to do?
Well, they're trying to be helpful in the best way that they know how. But I've even known, unfortunately, other health professionals who are in my field, in the mental health field or psychiatry field, who talk about depression or anxiety, and sometimes we'll make suggestions like, well, if you're feeling anxious, just take a few deep breaths and everything will be all right, like as if it were that simple. I mean, again, nothing is quite as simple as we make it out to be. So I mean, again, these simple little questionnaires are, again, a very simplistic way of looking at something, and just scratch the surface, So
with people actually experiencing some of the mental side of the fact, and when they experiencing physical things, do you see people get often not like being taken serious?
So I don't work in a hospital where I might see more of that. I have seen, again, I mentioned the hypothyroidism, and I have seen people come into my office, and when I used to work at MHMR, with sometimes with severe PTSD or other mental health issues, who also had some physical health issues. So yes, at times I recognize there's a correlation because, again, I look at things holistically. I can even talk about my own story. I mentioned the physical part of my story, which was I got a virus in my undergrad. I had hypothyroidism as well at one time. I had a history of colon problems on both sides of my family, which kind of predisposed me to have those issues. So there was definitely physical factors, but I also recognized that there was a psychological component from the trauma I experienced in my family system, family of origin. And so it's sometimes hard to say, well, everything is a factor. Well, I'm gonna, if I can, I'll talk about you for a minute, because I'd never heard the term FND until you brought it up, and I know, and we've worked together for a few years, and I know your story quite well, and I also know enough about your past to know that, when you first told me about FND, and you first told me that's what you were given as a diagnosis, it just seemed absurd to me, because it didn't fit the picture, your profile is the word some people would use. It was like trying to connect dots, but FND was out here, and you were here. This was your profile. If that makes any sense. There was no extreme trauma or there was no extreme, like a car accident from the past or something that affected, physical trauma that affected you, that would have led to some kind of diagnosis, in my opinion, humble opinion as a non-doctor, to the diagnosis of FND. Whereas, yes, I've seen patients with extreme PTSD, and where I can start making connections with some of their health issues. Is it possible for us to make those kinds of correlations? Not really. I mean, because we don't have, again, testing that's sensitive enough or things to do that. But I think sometimes, or it seems to me anyway, and I'm again maybe overstepping my profession, but that diagnosis is used when they don't know what else to say or what else to label.
So it's interesting that you haven't seen a lot of cases from conversion disorders or PNES, like in that spectrum of psychogenic term, then to brought to the field of counselor?
Yeah, I for whatever reason, even though on my Psychology Today profile, I talk about chronic pain, and I think I don't know if I mentioned chronic health issues. So I talk about that in my profile, and I think maybe on my website. But I don't know. It just seems like, again, it's an interesting thing that and maybe that's just, again, how we view things in our culture still. Like the physical problems are over in this category, and the mental health problems are in that category, and there's no connection unless you have symptoms that don't fit, or that we don't understand, and I'm not really sure. Again, I believe that that everything is interconnected, but at the same time, it has to make sense, again, within the context of
How to kind of identify it? Because I think we kind of mentioned a little bit before the interview that you said you do have patients who actually do have extreme PTSD but don't really seem to have anything functional.
Right. I mean, for all intents and purposes, they're healthy. I mean, some of them start to develop health issues. Well, we all develop health issues. So again, the doctor can't say, well, look, you seem to be developing fibromyalgia, and you've got endometriosis, and you've got ovarian cysts, and you've got whatever the things may be. Is there a correlation with that and the fact that you were sexually abused for 6 years as growing up and experienced emotional abuse? Is that a factor? All we can do is kind of look at it and say, well, that's interesting that there may be a pattern here, or at least that's the way I look at it. But I think, and I guess I could jump to this idea. When a doctor is working with someone who has a heart disease or cancer or diabetes or well-known illness like that, you probably will never hear the doctor say, well, I think it sounds looked into. Have you considered going to a counselor or a psychiatrist? That's not going to be the first thing they tell you. It may not even be a thing they ever will tell you. And so, or they're certainly not going to use the words FND or other words that you've been told, and obviously others have been told. So it's questionable. I'm confused by it, and I don't know what.
Is that maybe just because they can see some markers that it's abnormal?
Obviously, we have tests that we can see the cancer on scans. We have blood work where it's showing up on the blood work. Again, because it's already there. Again, like I said earlier, it's there now. We can definitely see it on the blood work. Now, unfortunately, we don't have the tests that are so sensitive where they would show up 5 years before you develop the cancer that would say, you know what, we're starting to see signs that you're going to get cancer if you don't do something differently. And let's look at some options here, or some things that you might change or do that might help to prevent that. So at that point, we're seeing it.
I know that it's being thrown around a lot with those functional things, or psychological issues that represent those. So I know that you have a few patients, or was 1, 2, like you remember, that actually do have both, like seeing physical symptoms manifested from trauma or possible?
I mean, I can only make, causation, correlation, I can only make, I can only look at patterns and go, okay, there may be some connections here. We may be able to connect the dots here, so to speak. I can look at myself and say, did the trauma I experienced growing up, did that lead to my becoming sick? I can't say, well, if I hadn't experienced that trauma, I wouldn't have been sick.
But do you think so?
Well, I'm saying I can't say that 100%, but maybe. Maybe.
So it's a question mark.
Because I know it had a big effect. So how much it's impossible to say.
I like your one of the analogy, but I think you mentioned that before too with your chronic illnesses, and is that often people having collective.
It's a very simple analogy, and it's a very two-dimensional picture, right? I think we could expand on that and get a little bit more sophisticated, or a little bit more something, I can't think of the word, and kind of look at it probably in a bigger third dimension, or a little more something. I can't think of the word right now, but yeah, the barrel effect. And it was actually, when I first saw that, it was at the Environmental Health Center. Dr. Ray had that in his building, and so in the barrel was like, again, he was big into chemicals. He believed that chemicals in our environment, in our food, etc., in our water, predisposed us to other health issues. Again, I think it's a factor. I don't think it's maybe as much as he believed. But so chemical, and to go along with that, metals. For instance, mercury. I'll just go there and say mercury amalgam fillings, and then you've got what else? Viruses, parasites, bacteria. Genetics, psychological, emotional issues. I know I'm missing a whole bunch right now, and then of course hidden allergies sometimes that people do have for whatever reason. So yeah, all of these factors, and I mentioned. I guess I could throw in mold, because that's I guess separate from chemical and virus and bacteria and all that. I mentioned the case of somebody becoming sick from mold. So again, you have all these factors that our bodies are supposed to just somehow adjust to, or detox, or whatever words you want to use, as if that's normal. It's really kind of amazing to me at times that we as humans can be faced with so many different obstacles, or so many different things, and still be fine. But sometimes we aren't fine, and we don't even know that we're not fine, because again, that we can't test for it. And so the barrel is filling up. That barrel is filling up, so the water's rising, but we don't know it. We just think, oh, I'm just a little tired, I'm fine. And then it's just sometimes just takes one more thing, and
So you think that with chronic illness patients, that in a sense working on mental health always would be really beneficial?
I think it would be beneficial for anybody.
Yes.
Any patient. Or person, whatever words we want to use, any client. I don't know anybody that hasn't experienced some trauma, and sometimes can't benefit from talking to someone, or learning some different tools of coping with issues. I'm, as you know, big into learning about mindfulness and meditation. And so doing some things of that nature, again, I think helpful for anybody dealing with whatever it is, whether it's cancer or heart disease. But
Let's take that occult condition into the picture as with these people, they often don't really get answers, right? So how can they beneficial from talking to someone like you, for example? With people with things like they just couldn't get diagnosis, and then they couldn't get doctors to pinpoint what's going on, right? It's often not really a nice, easy result.
Tests aren't showing up, blood work, etc. So you're sent to a counselor, and the counselor's like, well, it depends on your counselor. Not everybody. I'm not trying to, lift myself up here or whatever, but not every counselor sees things holistically. a lot of counselors kind of have been taught in a similar way to the medical model, and so counseling is this, So we talk about stuff and we have feelings because I know that we are not just our head and that we're not just our body, that everything works together. Again, I try to work with people to incorporate the body, incorporate feelings in a more kind of holistic fashion, and so that we live not just up here, but in here as well.
So in a sense that you need to make your body function to make that mind actually work even better.
Well, to at least, all of that. Yeah.
So if, someone who actually been dealing with the medical gaslight, you think those trauma can also turn into physical manifestation?
Well, I mean, I guess on some level anything can, but yeah, people who have been, specifically gaslit by the medical community. I mean, I think that's more that can be more frustrating, and also that can be more. I think for some people it could cause them to possibly give up. So, I mean, in the long run, I think it could be detrimental to some people. Yeah, because you go to a professional, whether it's a neurologist or whoever it is, and you're told, well, all your tests are fine, and so therefore you're fine, and so I mean, because we still view doctors oftentimes as here.
Authority.
They're the authority. They know everything, and unfortunately they sometimes I think they know everything, and so that can be difficult to hear from someone.
I like the way that how you work the body as a whole, because we are, and unfortunately I really hate those kind of separation of our head and the rest of our body, or in some cases, people are dealing with actual trauma. How do you see trauma itself with the fact that it can be manifest into something that is PTSD? As what's kind of like the little, telltale sign that you need to seeking for a professional help?
Well, I mean, PTSD, we throw that term around, but I guess we could define what that term even means, and I have to get out a book to define that. But, I mean...
A simple definition.
A simple definition... it's sometimes not easy to make, honestly, a diagnosis until you start digging around. Because PTSD oftentimes looks like depression, anxiety, all these things we've been talking about, mood swings, trouble sleeping. Sometimes it could be nightmares, it could be remembering whatever it was that you experienced, whether it was a car accident, whether it was abuse of some kind. But sometimes it doesn't have to be connected to the trauma anymore. Sometimes we start developing other triggers, as we start calling them. Sometimes it's just a feeling of not feeling safe in different environments, or whatever it might be. It starts to connect to other things, and so,
Do you think that kind of definition and the way that something that can trigger, the PTSD, in fact, the medical doctor would really understand it? Or are they fully understand to be qualified to call someone having PTSD related symptoms that is physical?
Well, no, I don't believe so. To answer that question, no, they're not. I mean, even psychiatrists, unfortunately, the way the insurance works these days and the time that people spend with clients is not long enough oftentimes to make a diagnosis. It takes more than 20 minutes sometimes to make that kind of a diagnosis, and how many psychiatrists or doctors spend 20 minutes with you, even on a first appointment? I used to spend an hour and a half with clients when I worked at a local nonprofit mental health center called MHMO, and in that hour and a half, that was my job, to diagnose, to do an assessment. And it takes at least that amount of time, and sometimes it takes longer, because you only get so much information. So you start seeing pieces of the story, but you don't still see the whole picture. So it takes a while sometimes to be able to give that kind of diagnosis.
So you think that if a doctor going in for 5 minutes and they're not able to see the whole picture, isn't it?
Yeah, no, that would be... in 5 minutes they can see the symptoms. That's kind of like looking at a car. In 5 minutes I can see that your engine's not starting, and that you've got a light on the dashboard that says there's a problem with the engine, and maybe I can plug in some instrumentation that says, well, it looks like, maybe it's this or that or something, but I don't know. That's about all I know. I can't do any more than that. Yeah. There's nothing you can do in 5 minutes. Like I said, there's very little you can do in 20 minutes. I look at myself, and I knew that. I never considered myself as having PTSD until I went into counseling, and until I was able to go through the program myself, and then I was like, well, look at that. I guess I've got PTSD too. So it's not something that you can't really.
Do you think it's helpful for people to have a label of knowing that PTSD, or,
Yeah, yes and no.
I kind of want to hear the no, but...
The no, in some ways, really the answer is no. I mean, the answer is yes in some way, just because if I say to someone, yeah, there's you definitely, obviously there's some PTSD going on here, that's causing some of these symptoms that you're having, the anxiety, depression, and it's only helpful in that at least it lets them know that, oh, I'm not crazy, and it helps them, like all of us, it helps us to have some understanding of what's going on. But beyond that, at the end of the day, you still are left with, okay, well, I have these symptoms, I have this narrative, this story, I have these thoughts. And I've got to do something different for, or do some things that I haven't done before to help myself feel better, mentally, physically. Again, to make this connection, body-mind connection, to be able to function at a better level. That's regardless of the diagnosis.
Yeah. So that means when people are undiagnosed, do you feel like it's actually better for them to be undiagnosed or misdiagnosed?
That's not, I don't know if I've got an easy answer for that. I mean...
I think you mentioned a little bit about bipolar has been overdiagnosed a lot.
Sure.
Just in your field, not even medical diagnosis, often that there's a diagnosed label, right? Mm-hmm. And for people to feel belong to, and they will say, oh, you have better prognosis for this one than that one. Do you feel it's better to actually getting those labels or not diagnosed?
Well, yeah, I don't have a simple answer for that. I mean, I think sometimes it gets complicated because everybody's different, and if we look at some people. Who never go to the doctor, maybe not knowing is better than knowing, and sometimes knowing something, where even if it's the wrong thing, can be helpful for some people. It at least gives them something to focus on, but there's no easy answer. That's why everything I'm saying now has two sides to it. But at the same time, getting the wrong diagnosis, can also cause trouble. Oh, I have bipolar. Well, therefore this and therefore that. And it's like, well, not necessarily. Not everything's that simple, So sometimes that diagnosis I've seen in some cases hasn't been helpful. And it's complicated. I mean, I could use autism as an example. I've known some people on the spectrum where they accepted the diagnosis and that was helpful for them, and others who fought against the diagnosis, and so it's sometimes complicated.
Yeah, I mean, I asked it because I know that there's two sides of the story, and often it is difficult for a person to feel on either side, and of course it's much easier if this person just like simply get diagnosed, like you said, cancer or something. So with mental health patients, do you feel like it's fair to them to say, well, you have bipolar, you must have this, or you have this mental health issues, so physical issues is psychogenic? Do you feel like your patients, if they have a mental issue, it seems like they never really have any physical issue, or in your experiences?
Well, I mean, I don't focus that much on physical health issues, obviously, in my practice, because people come with mental health issues or relationship issues, and so that is my focus. I'll make suggestions sometimes to people, and either to see another specialist, if I can even, if there's one out there that I think might be helpful to them, but and I think I just lost myself on the answer.
No, it's okay. Like, we don't need to have everything put it, but it's good to explore a little bit. But if one thing that you feel like after everything you've been through and you see the problem of the medical side and compared to the holistic way approach, if one thing that you really want to change, or you really think that should change in the medical system, in the healthcare field, that makes better for patient care, what that would be? Or it's just too many things that you want? I
don't even know. It's that's the thing. I think that's part of the reason why we are where we are. The other part of the problem is unfortunately the medical field is a business like any other.
Yeah.
And as long as we have a system, the socioeconomic system that we have, it's always going to be a business. So I think that's part of the reason why some people are wanting to go to a one-payer system or a government-run health system, in hopes that it might improve that way. But I don't know. It's tough. I remember. My father used to tell this story, and I don't know where he got the story from, about how in some place years ago that patients would only pay their doctor when they were well, or how did I forget how this worked. I can't make sense of it. But they wouldn't pay when they're sick, so the incentive to the doctor was to keep them well or something. I don't remember. Going back to your question, yeah, what do we need to change about our system? That's such a big question. I think we need to be more open-minded. I think we need to work together more. I think we need to listen to each other a little bit more. Even within the medical field, as I said, and that's part of the reason I use that story or shared the story of Dr. Ray and my own story was, here's a medical doctor, a surgeon that was ostracized by many in his own field. Because he looked at things differently. So I don't know what to do to make that happen, except to just continue to have conversations, kind of like we're having now.
Yeah. And
yeah.
So it's like, well, it's just another conversation, and we're not going to make any more changes and stuff, right? I know that it's a really difficult situation because of that kind of capitalism issues. So the patient is left out the system, and from you experiencing it 30 years ago.
30 plus years, yeah.
Thank you for joining us on this insightful episode of Occult Awareness with Mark Michalica. We hope his story and expertise have provided valuable perspectives on the complexities of living with or treating occult medical conditions. If you or someone you know is navigating similar challenges, remember that support and understanding are out there. Our podcast aims to offer hope and understanding, share knowledge for bridging the gap between patients and the broader medical community. Don't forget to subscribe to Occult Awareness for more powerful stories and expert discussion. Share this episode to help raise awareness and foster a more compassionate and informed society. Until next time, stay strong, stay informed, and keep advocating for better healthcare. Together, we can make a difference.